think there's both sides of that.
And I want to ask another question to the floor. And
oh, we're live, Kellyann.
We're
we
live.
Just went live on Facebook.
Hey everyone, welcome to Doctor's Night Out. I am your host, Dr. Kellyann Petrucci. Welcome this evening. We have an amazing panel. I'm hosting this evening with Dr. Pedre. Hello, Dr. Pedre.
Hello.
We've been having an amazing discussion, and I want everyone to watch this. We're going to post this everywhere. You don't want to miss this series, this segment, because I am already completely glued to these experts out here. They are all physicians, they're all medical doctors, and we have a nurse with us, Nurse Kathleen, and Nurse Kathleen was just telling us, you know, this is what happens on the front lines. This is what we're seeing. We have Dr. Gomes, who is telling us, top right, who's been telling us what's happening front line. We have with us Dr. Scott Antone and his wife, Dr. Ellen Antone, who are also telling us what's happening. They're emergency room trained doctors, and we're so happy to have Dr. Lisa Koch, who is going to be talking with us about a lot of goodies. So you can't miss this episode. And we also have someone on this panel, unbeknownst to you yet, who actually had COVID, and they're going to take us through the COVID tunnel. But you're going to have to wait because there's a lot of good information to come. So let's, you know, if I may steer this a little bit, and, you know, I always say the show's a little scripted, and here's why it's scripted, folks. It's scripted because I want to make sure that you get the right information that I know that you want, so we're clear and we're concise. But every once in a while I pivot a little. So this is a pivoting moment. And I just want to ask everyone, because we're talking about what's going on inside the hospital, what's happening with the data, you know, all this interesting stuff. I just want to know a little bit about medication, and I don't want to get too into it, but I had someone that I just spoke to that felt like they would not be here. You're going to be seeing this person who is a public figure, and he had COVID, and he was in very bad shape. His son dropped him off at the hospital, and he told me this story that unbelievable. As they told the story, not to me, to their congregation, about this unbelievable situation where, I mean, I don't know if people realize what's happening. Like, they're dropped off, plunked off at the door. Your loved ones have no idea if they're going to see you again, because they hear, you know, on the news, this stuff is bad. This is bad news. They don't know what's going to happen. They don't know what the outcome's going to be. And then these wonderful professionals, you know, like Nurse Kathleen, you know, like Dr. Gomes, they come in and they, you know, you are entrusting these health professionals. So this person said, I don't believe I would be here if it was not for hydroxychloroquine. And, you know, I hear other reports that, you know, the data is not showing that's working. So if I can just take a moment here and just talk to me a little bit, I want to start with the Antoines, and please forgive me, Dr. Coach, we're going to get to you in 1 second. You're triple board certified. She has so much to offer, but we love looking at your beautiful.
It's all good.
So, but I want to know from the Antoines, tell me what medication is working.
So that's a great question. When, you know, when this first came out and then people started talking about hydroxychloroquine, chloroquine, and then azithromycin, the reason they did is because these medications were found to work with SARS-CoV-1, the original SARS virus, in 2003. And so that actually had a mortality measured at about 10%. And then later on, the Middle East respiratory virus was about a 35% mortality. Fortunately, they were not as catchy or contagious as what we're seeing now. But it was found both in vitro and in people that hydroxychloroquine, chloroquine, and also azithromycin were helpful. They all had antiviral effects, even though we think of azithromycin as an antibiotic. What they do is, for hydroxychloroquine and chloroquine, they raise the pH inside cells, which is unfavorable for the virus, and the virus dies. Also, chloroquine binds to this receptor, this ACE receptor on human cells, which then prevents, they think, the virus from binding. So it makes sense that they work. Azithromycin also, there's really good data for preventing and treating respiratory distress syndrome with azithromycin. There's been some randomized trials which have shown that. The issue that we've had a bit with this is this is an emergency situation. It's an intensive care, critical care emergency situation. So we don't have time. When this originally started, people were very critical, saying, don't recommend hydroxychloroquine, don't recommend these things, because we don't have a 10,000 patient double-blind placebo-controlled study. And the reality is there's not time. And when you have a medication that's pretty safe, hydroxychloroquine, chloroquine, azithromycin, they're pretty safe. Sometimes trouble used together with the EKG, but other than that, it made sense to try them. Same thing with intravenous high dose vitamin C. So about 2 weeks ago, we actually came up with a protocol using methylene blue IV to be used for inpatients. And we've sent that off to several institutions in New York, as well as the CDC and the FDA, hoping to stem some clinical trials with it.
Wonderful.
We're trying a lot of different things now.
Can you explain what, for people who don't know, what methylene blue, what is that? What is it used for? Why would it be helpful here?
Sure. So methylene blue is actually the ancestor of hydroxychloroquine and chloroquine. It was the first malaria medicine. In fact, it was the first mass-produced medicine in 1870 or so. And what's interesting about methylene blue is it's a dye, and it works when people take it and are presented to sunlight. So there's a photomodulation with it. And they've actually found in this disease, so it does several things. So methylene blue works just like hydroxychloroquine and chloroquine, but doesn't have the side effects. It also will restore normal tissue oxygenation. You heard Kathleen talking about the fact people will come in and suddenly their oxygen saturation is 70. And they don't always look like their saturation is 70. So there's a bit of a problem with tissue oxygenation. Methylene blue has been shown to help that. Also, these people are dying of septic shock where their blood pressure suddenly drops. And methylene blue is used in the hospital after cardiac bypass when people have this sudden episode of shock, and it's been used to improve survival. So it makes perfect sense. It has less side effects. The protocol we had designed was for IV use of IV methylene blue, but it's also a really powerful antioxidant. It increases glutathione, does a lot of good stuff, and it lowers interleukin-6, which is what we think causes this cytokine storm that's killing people in the second week.
And they're using methylene blue to kind of clean the blood for this plasma that they're potentially using. I mean, they're using methylene blue to kill
Right.
viruses. So already being used that way. You'd be amazed though at, we presented this to a lot of hospitals, to a lot of people, and there's so much red tape that again, they're saying, well, it has to be FDA approved. There's not time, if people are dying and they're in the intensive care unit and there's no other option, like here's an option and you use it for other things with very little risk to the person. So we're having difficulty where we've spent so much time on this research to have somebody really just try it, even on one patient, implement it, see if we can get some data back. So it's been a bit frustrating.
Unfortunately, we've got a little bit of we're a litigious country. We just are.
Right.
And there's a lot of other countries that they said, let's use it. If it works, we'll deal with it later. There are countries that do that, and but we're not one of them. And so things the can does get kicked down the road. Dr. Coach, I want to ask you a question. There's certain health problems that people have that predispose them to this issue. And I think we're learning a lot about that. As I say that we truly have to build this armor, which I think Dr. Ellen and Dr. Scott are trying to do with what they're coming up with, is really help build that armor back into the body. Tell us about the certain problems that people have that could lead them to perhaps not the best outcome, and why we really have to start cleaning this stuff up.
Absolutely. And in Tampa, the cases are not that devastating right now as well. And I run a very busy, about 6,000 patient internal medicine practice where we handle both primary care and functional medicine. So it's a nice blend, very much focused on exactly what you're asking. And I spent a lot of time at the very beginning doing virtual visits, trying to guide people when to go to the hospital, when not to go to the hospital, what we were talking about a little bit earlier. And I am now, actually, there's silver lining in the fact that we are seeing comorbidities with worse outcomes, like what Kathleen was saying earlier, between obesity and diabetes and hypertension. And most of these problems and poor dietary intake with lots of inflammatory grains, they're reversible, they're fixable. You can take action. So if it takes a little bit of fear from this pandemic to get people motivated to finally take action, then that at least can be one positive we can get on the other side of this.
I love how you say that we can look at this as a wake-up call to stop outsourcing our problems by getting prescription after prescription. Instead, we're starting to learn how to take charge of our own health. that's a nice inspirational bite there. Explain what you mean, because there are people, you know, as I said, that watch and listen that really are only getting what they hear in one vehicle, in the news, and they're not understanding what we mean by that. So explain that.
And I think it's a really quick, important point. Why I got very motivated to become vocal at this time was because when it started, I was only hearing about devastating ICU cases and the need for ventilators and you know, how fast people were going down. And then I was hearing on the other side, the whole public health, stay inside or you're going to breathe on someone and they're going to die. And I sat there and I said, where is the middle? Like who's leading the people in the middle, which is pretty much the rest of humanity, and giving them actionable things they can do instead of just leaving them in fear. And then I realized, well, that expert is actually me because I'm an internist. I handle infectious etiology, and I also motivate people to take charge and take responsibility. And so I think that I started speaking, doing Facebook Lives daily, where I was just giving a summary of the science and then an actionable and applicable tip that they could start doing right away, and end with a positive affirmation just so we could get people out of the fear mentality. And I think getting them to understand that there are things you can do. Unfortunately, in our traditional medicine and the paradigm that we have been in this country, which is clearly not working, the pill popping, drive-by, get fixed paradigm that, you know, all of us have been bucking against for some time now. Again, I think it's the silver lining of this pandemic because there's no drive-by pill for this. So the medication to treat the symptom, to have a symptom from the medication to treat that symptom, it doesn't work here. So we are all finally saying why and what next and what can we do.
You have
Dr. Koch, if I can ask a question, I'd love your opinion on the outliers. You know, that like they're saying those younger people are coming in with getting strokes or just respiratory distress. What do you think about those cases?
You know, it's a great question. And I think I'm very much also into kind of the spiritual side of medicine. So I would almost wonder what stressors are they going through? Or is anybody asking that when they're looking at healthy 20-somethings? So maybe it's another stressor with regards to even energetic stressors, Wi-Fi, a lot of people with the conspiracy of 5G, and you know, some of our younger people are way more plugged into electronics. So I don't know. It brings up again something where we need to be asking why, and we need to be digging deeper. So we'll find out.
Or is having a, you know, from the Western perspective, an underlying condition, are we really defining what underlying conditions are correctly? Because isn't inflammation an underlying condition?
Right.
Even if you don't have a diagnosed disease.
Right. So, you know, we see people as functional medicine practitioners, all of us, that look pretty normal from the outside. And I had to go to the extreme of doing some really out of the box diagnostic tools in my office with a naturopath doing kinesiology to find their leaky gut and their source of their inflammation. So your point is really, really good, which is, you know, these totally normal people could very well be ridden with, you know, nobody's checking their high sensitivity CRPs when they're showing up with COVID. I mean, they may have way blown out of proportion leaky gut and a lot of other things that don't always show up on the surface.
Yeah, and so I see the Antoines, they look like they're like bursting with, you know, like they can't sit still.
I was just going to say, this is what we see all the time. So I love that we're talking about it, because the reality is in our practice, we focus on, often we see the sickest of the sick who have been a lot of other places, but they often don't have a diagnosis. They end up having environmental toxicities or you know, sort of chronic infections, but they don't have a specific diagnosis. They just don't feel their best. And what we also see as part of our practice is people who come to us and they just want to get better, but they just want to stay healthy rather. And they will say they feel like they're their healthiest. And when you do this, you know, deep dive and look at some lab work that otherwise wouldn't be looked at, you find all these things that are under the surface that would have never been, you know, found or discussed. And I love that you also talk about kind of the spiritual side, because there are so many stressors that we're under, like, you know, not just the toxins and infections we're dealing with, but just so much stress. And one of the silver linings of this whole thing is to be home and to have the opportunity to look at our lives and slow down. We have 5 kids that are teenagers and one 21-year-old, and we're running around all the time. And it's amazing to recognize the impact of the craziness that is normally going on in our life and not have it, and how much healthier even I feel. And I think I take great care of myself. It's pretty amazing.
I don't know about you guys, but not having to do the New York City commute, now that I see the contrast in how I feel in my body, you recognize, I tell my patients that even if they don't feel mentally stressed, that they are biophysically stressed by having to get to work, by navigating the subway, by the push and shove, the sirens on the street. All of that creates stressors for the body.
Absolutely.
It does indeed. And so there's a couple more things I want to speak about. We're running down on time, unfortunately. And I'll start with you, Dr. Coach. Let's talk a little bit about, we're going to talk a little bit about mitochondrial health, because I know that's really important to you. And people may be asking, what in the world is mitochondria, and what does it have to do with talking about something as intense as COVID? And then I want to pivot for a minute, but answer that question for us.
So mitochondria have been really underutilized and understudied. We learn about them in high school biology. You may remember they are the powerhouses of the cell. They take electrons from the food we eat and oxygen from the air we breathe, go through a super complex level of steps and spit out ATP, which is our energy fuel. So they are important in every cell of our body, other than red cells, by providing the fuel for the cell to do what it needs to do. So when we talk about importance in COVID-19, you need an on-point immune system. You need everything's got to be functioning at a much higher capacity to go to battle with this beast of a virus. And if we don't have optimal mitochondrial function, we're just starting out behind the 8 ball. So we now know that you can trigger mitochondrial biogenesis, which means you can make new ones. And I don't know about the other panelists, but I never knew that until not that long ago. I thought what you had, that's what you were served with. And with my personal health history, I had chemo and a bunch of other things happen. I knew that a lot of them were gone, and I thought I was just stuck. But now there are things that you can do, actionable steps between everything from grounding to red light therapy to different nutraceuticals that can help, and much more. Intermittent fasting, the ketogenic diet will trigger the function, enhanced function of your mitochondria, but also production of new ones, which is going to keep us, when we talk about how to prevent, because I don't think this is the last, unfortunately, infectious problem we're going to be dealing with. So moving forward out of this COVID-19 is going to be all about how do we optimize this vessel, and mitochondria are right there at the forefront.
And I want to give a shout out quickly to moms, because we inherit our mitochondria from our mothers, not from our fathers. So we get our energy source from the moms out there. So shout out to all the moms with Mother's Day coming up. Thank you for the mitochondria that you gave us.
You're welcome. So we're going to talk a little bit more about logistically how we can build this armor. But I want to talk about, there's 2 more ideas of topic I would like to discuss, and one of them has to do with Kathleen. Kathleen, you know, again, it's your day. You're a nurse, and today's Nurses Day. And, again, we applaud what you do. And so we just got some great perspective. And, I want everyone to know these people are, these fine people are getting nothing from doing this. They are contributing their time. They are busy doctors. Every person here sees patients. Okay. And that is a beast. I'm being honest with you. I'm not going to pull any flack. It's a beast. It's a lot. And, we have people here with kids, everything else, and people are homeschooling now. Everyone's contributing their time. So again, thank you, Kathleen. But I want to talk about something. I want to really shift attention to you, because you have been through quite an ordeal. I want you to talk about what it's like being in the COVID tunnel, and how does it feel to be out?
So when I first got sick, I had a sore throat and body aches. I attributed it to my allergies, like I've heard a lot of people do. I ended up getting a fever shortly after that, and had that fever for 12 days. I had shortness of breath, especially when I was up, a lot of dizziness and Then I just had general like dull aches in my chest with some sharp pains intermittently. I had really bad headaches. And then about the last 3 days, I had all the GI symptoms, no appetite at all. I ended up losing 15 pounds throughout that whole 2 weeks. So then after all of that, I was just very weak. The fatigue lasted, it's still not gone, but it lasted a good month.
What were the GI
and
symptoms like? Did you have nausea? Like, what did you experience there?
yeah, lots of nausea, diarrhea, just really sick to my stomach.
So would you say, because I've heard this from other COVID patients, would you say they said, I've never felt like that before? That seems to be something common.
Yeah, yeah, it was definitely a different feeling. And yeah, it's nothing like, I don't usually get fevers at all. So having it for 12 days was different. And it just the whole time, it's not, at some points you just felt just off and you just didn't, it wasn't like you were sick all the time. It was just like in the morning, sometimes I feel a little bit better, but still just not myself.
How long was the whole experience?
A little over 2 weeks.
A little over 2 weeks.
Did you get to the point of hypoxia, or that you felt oxygen starved?
So I do have actually a measurement at home, and the lowest I saw was 94%. So not super low, but I was monitoring it just to make sure, and definitely dipped lower after being up. So I did a lot of sitting, which is not like me.
Yeah. So that's basically you just sat.
Yeah. Laid in bed, and which I didn't feel that well, so it wasn't that big of a deal. But towards the end, when my fever started breaking, it was like, yeah, I was ready to get up and get out of bed.
Yes. Did you isolate yourself? I mean, was it hard not being around anyone?
Yeah, it was really hard. The four walls got really boring. When I was the sickest, it wasn't as bad because all I really wanted to do was lay in bed. But yeah, it was really hard not to be around family. My family's 2.5 hours away, so they were worried about me. I was worried about them, worried about me. So and then they just didn't know what I have a history of autoimmune stuff, so they didn't know how it would affect me, and we all knew how quickly it could turn bad. So that was the hard part too, just the unknown.
What do you feel? What was the best treatment protocol that you feel that you did that brought you on the other side?
So actually, I'm a patient of Dr. Ellen too. So she helped me a lot through the whole thing. And since I do have autoimmune stuff, I was on a lot of immune boosting supplements already. But we did increase and add a few, specifically like vitamin C. I was doing high doses of that, vitamin D, zinc, melatonin, glutathione, NAC, phosphatidylcholine. And then because I was getting such bad headaches, I was taking some magnesium and the quercetin for that. And that seemed to help a lot.
Mm-hmm. I love
quercetin. How did you test positive for it?
Mm-hmm. There was a drive up testing site. So it was literally like in a basement. And I drove in, kept my windows up the whole time, called the people as I was going through the line. And then I got to the basement part in my car. I rolled down the window and they did the nasopharyngeal swab.
Mm. Kathleen, if you could say, is there anything that you really feel, did this change you in any way? Did you learn anything from this experience that, I mean, do you feel different than you were before, being an integral part of a pandemic, both on the front lines and experiencing this yourself?
Yeah, definitely. I had a lot of time to think when I was sick too. And just to realize how much support was there was really meaningful. it really meant a lot just to see all the people come together, even not just in my life, but in the world. It was cool to see so many people helping others. And I mean, it's something I'll never forget.
What do you think is the key that helped you pull through that COVID tunnel, as Kellyann has called it? What was it that mentally like helped you get through that?
Definitely just I have a great family that, you know, they were there with me. I mean, not with me, but we were constantly FaceTiming and all of that. So that was helpful. And then just my work family, they were all also like reaching out. And it just, you know, the support, it was really, it helped me through the prayer.
Those are like the spiritual intangibles that Dr. Koch talked about that are so important. For all of us.
Doctors, thank God. Well, we're so glad that you're better. We're so glad that you're better, and we're so glad that you're probably better in a lot of ways. So we're glad you made it through. There's two things I want to talk about, guys, before we hook out of this. Number one, there's a pressing elephant in the room, and that is the big controversy that we're talking about. I want everyone to give it best practice. So hang in there if you're really wanting to know from a supplement standpoint and all of that. We're going to get to treatment protocol in a moment. What do you feel? And we're going to do a quick fire. I want to get everyone's quick opinion. What do you feel? Do you feel like we should open the floodgates and it's okay to go back out? Or do you think that we really need to stay in? Do you think that, you know, New Jersey just extended to June 15th, and you know, Michigan extended, and there's a lot of governors that are extending the stay-at-home mandate. So let's start with you, Dr. Koch. What do you feel? Do you feel like what is the smart and reasonable for everything involved?
Unfortunately, I do think it needs to vary to a certain degree, state to state, based on the caseload. Here in Tampa, completely crushing small businesses and the economy when our biggest crisis ER had no patients a couple of days ago, like literally zero census for a period of time. It doesn't make sense to me. So I think not open the floodgates, but some type of structured easing back in so that we can get people back to work and they don't have all the other problems that happen without their livelihood. But I also think we should stress to the people that are the highest level at risk. You know, any other pandemic or infectious problem, it's usually those people who isolate and are staying in. So maybe we should sort of swap as the healthy people start going out. If you're really concerned, highly immunocompromised, elderly, that you should continue the social isolation longer.
Okay. And Dr. Ellen, Dr. Scott, what do you think?
So it's the $1 million question that nobody knows the right answer to. And I agree with Dr. Koch in terms of, I think it's different in different places depending on the load. I think part of the issue is that we need adequate testing. We need to be able to, you know, there are people that are carriers and they don't show any evidence of illness. And so if we had the ability to test everybody easily and trust the results of that, I think that would help us. There are some, you know, Japan just opened up their schools and started letting students come in. And then there's been a rise in cases, and, you know, whether they're going to close the schools again is to be decided. They haven't decided that. So I think opening, you know, it is crushing to the economy. It is crushing to small businesses, and trying to make the best decision possible, taking this opportunity to, you know, educate people about how to be their healthiest so that we don't end up, you know, immune compromised with chronic diseases. It's a hard question. I don't know. What do you think?
Flattening your own curve, Dr. Koch. I mean, you hit the nail on the head, right? So we talk about flattening the curve. I think flattening your own curve is key. And so I think we would all agree with that. But I think it's really interesting, and I would love to know why. It seems to be, sure, there's population density, but it's so much work. Even the acuity in New York is different. And I wonder, is it a mutation of the virus there? Because other big cities in the Midwest here, Chicago, aren't hit, and they have areas that are just as dense and poor. And So it's interesting to me. So I kind of agree that maybe it needs to be different in different places, because we've had it hit here in Indy, but it's nothing like New York, and we're not a small city. So, and it's definitely worse at St. Vincent, where Kathleen works, than it is at St. Francis, where I had worked. So it's a really good question, but I think the idea of different risk groups as well, boy, that really hits the nail on the head. It's like anything else. Bayes' theorem. So that what's your pretest probability that you'll die from this disease? We know who it's high for, and those are folks that are probably going to need to stay in.
Dr. Gomes.
I agree with everyone so far on the panel. It should be regional. North Carolina is not getting hit very hard. Our hardest hit county is Mecklenburg, where Charlotte is, and they have a few thousand cases out of a population of just over 1 million. The mortality here is not nearly what it is in New York City. And in going along with what Dr. Koch said, is, with regard to comorbidities, when we compare to countries like the Netherlands or South Korea or others, we have a very relatively unhealthy population in the United States. There's a lot of metabolic disease, diabetics, obesity, insulin resistance is rampant. A lot of these young people, just thinking back to when, we were talking about the testing earlier and who testing what criteria were. When I was filling out the forms, their race, their age, and all that, and it would ask, do they have any medical conditions? Well, 20 and 25 and 30-year-olds don't have any medical conditions. They don't go to doctors. They don't get evaluated. They're not getting tests that actually tell. That's right. And so are these 30-year-olds that are becoming severely ill not in the stages of, diabetes, of metabolic syndrome, of, chronic systemic inflammation? Who knows? We just don't know that. So we check no medical conditions, and that gets put into the database. I think, it has to be state by state, which I think is appropriate. The Southeast is not hit very hard. Economically, we're hit very hard, but not by the condition. And I think in going along with, flattening your own curve, I think is really where the answer is at, because the whole purpose, and I think this has been lost in the communication, coming out of the White House and out of, the general media, is the whole purpose of flattening the curve was to preserve our healthcare system. It was to keep hospitals from becoming inundated with patients that we wouldn't be able to handle, and we would be like Southern Italy, where we would be turning people away because we didn't have enough ventilators, we didn't have enough ICU beds, and yet we have ICU beds that are empty. And we have nurses furloughed, and we have emergency departments that are at 50% capacity, and doctors being laid off or furloughed because we're not inundated. And so reopening is not putting us at risk of the reason why we're flattening the curve in the first place. But it is affecting so many other things, including the stress that's been talked about, the stay at home, the can't go out to eat, or can't go out to a shop, or can't see your friends, or go visit your family, or, all of these different things that worsen your immune function by being chronically stressed and isolated, and, that actually make you more susceptible and put you at even higher risk of getting, a more severe infection. So that's my personal take.
It's a catch-22, Doc. It's a catch-22.
It really is.
Shutting beaches down. What could be more healthy for the immune system?
Right.
Grounding, go on the sand, go in the ocean.
Yeah, I mean, that's the first line for so many doctors I know. I mean, so it's tough. Dr. Pedre, I know that you did some statistical analysis on New York and what's happening there, since that's ground zero. Do you have an opinion on stay home or go out?
What I'm seeing here is that I think we're eventually going to have to think about the balance of the scales between what's happening with the economy. And I like thinking of, beyond COVID, how do we reduce total harm? Because there are going to be other things we are not measuring. Mental health, people going hungry because they lack food, the stress and what that does, that then maybe leads to heart attack, to stroke, like all other factors that are kind of peripheral to this, but are going to be a result from an extended strangulation of the economy. I think New York, because it is ground zero for this, again, somehow, and I think New York has just a much greater population density than other centers, especially Manhattan has 8 million people, you know, all crammed into a tiny little island, and there's a lot of surfaces that get touched by multiple people just going in and out of stores and stuff. So, but I do think that we need to start thinking about a phase 2 here, where maybe the least susceptible people can start going out and stimulating the economy again, while all those that are the weakest, the immunosuppressed, the elderly, they stay in quarantine for longer. And I mean, I think there's other countries that are doing that, and you're not seeing horrible results there, like in Sweden, where they haven't gone to a full shutdown. So I think we need to look at other countries, see what they're doing, and use that as guidance as to what we should do. But ultimately, I think we need to figure out how we move forward. And of course, as we've been talking about at every virtual doctor's night out, that we've got to stop thinking of the virus as the enemy, because as Dr. Koch was saying, it's going to be this virus, it's going to be another virus. Mm-hmm. The enemy is not the virus. The enemy is the inflammation and the disease that occurs in the body that then makes you susceptible to an organism like this.
Here. Virus. Beautifully put.
Absolutely.
Beautifully put. And that's where we're going to go moving forward. So we're going to end this evening with just one other kind of hit here, where really we went over this evening, which I knew we would because we have so many doctors with so much to say. I think it's worth the extra time. I want everyone to give, on the panel, if you would, give a hit to everyone, put together your prescription for moving back. And I would love to offer all of you to come back for Doctor's Night Out number 2, for all of you to talk about what we can expect beyond. So on the other side of COVID, I would like to publicly invite all of you back for that, because I'm just so in love with this panel and the high intense knowledge base that you all have. But let's all do a hit. And I want everyone to go through and say, this would be my prescription, my generalized prescription for you to either build that armor, to get through this emotionally, to feel stable and grounded and not in fear. Whatever it is you want to offer, give us all a hit. We're going to start with the Antoines. Dr. Ellen, Dr. Scott, give us your hit for the evening.
So I would say, this is a perfect opportunity to take an evaluation and self-reflection of your life, and to have the ability to change it. And I would look at the things you can change right now. Your diet. You can, I typically tell people to envision their diet like a plate, and at the end of the day, think about what would be on that plate. And I would say, if you can get half your day vegetables, and a quarter of that plate be healthy protein, and a quarter of that plate be healthy fats, you can start there. Spend your time feeding your body, nourishing your body, helping your body have the nutrients so that your mitochondria can make energy, your immune system can work properly. Start with diet and evaluate your stress. Take time to take a breath and think about the future, how you would change things going forward.
The only thing I would add in terms of mindset is we did a Facebook Live about this a while ago, was changing your language to yourself. So rather than saying I'm locked down or I'm quarantined, it's I'm fortunate to have the ability to make the intelligent decision to stay home for my health. So things like that you can say to yourself, and really I think that's immune boosting as well, because stress is a toxin.
Beautiful. And Dr. Gomes.
Yeah, and actually that's a great point that Scott just made, about how we think, the negative thoughts is so toxic, and it really affects us. But I think to add on to what the Antoine's just said is get outdoors, spend time in the sunshine, breathe fresh air, get out on a trail, if need be, certainly wash your hands, if you're going to be out in public places. But everywhere, we go, we carry, some hand sanitizer, some natural hand sanitizer, so that if we are out, we can, spray down afterward. Get out and exercise, get on a bike, go for a hike, supplement wisely. I know we didn't get into that, and so that'll, I guess, be for another time. But boost your immune system. Focus on going to bed, turn off the technology, and connect with family. Connect with, even virtually is connectedness in this regard. And allow that healing, to take place.
Beautiful. Dr. Pedre? Even though
geez.
you're co-host, you have so much to say. I have
Ditto to so many of these things. Like I think the body heals in the parasympathetic state. So all the things that Dr. Gomes said enhance the parasympathetic nervous system. And it also enhances your oxytocin, which is the hormone that opposes cortisol in the body, and it has an anti-inflammatory effect. So think of like Scott talked about how hydroxychloroquine raises the pH in the body. Well, oxytocin is your alkalinizing hormone. Mm-hmm. So doing things that you enjoy, picking up hobbies, painting, being out in nature. For me, it's cooking a meal. Like that gets me into that oxytocin state of like presence and connection and gratitude, connecting over FaceTime, because humans, we are visual beings. Mm-hmm. So seeing another person's face, interacting with them like we're doing here, that also boosts oxytocin and has an alkalizing effect on the body. So kind of speaking towards all those spiritual, mental aspects that are so important. And I think people don't give them enough credit of how important that is, one of the key pieces to creating the full picture of your health.
Beautiful. Dr. Coach.
So what I am doing with all of my patients that are coming in, because I'm still actively seeing a lot of people every day, is I'm telling them to take this time as a gift. And many people out there, especially people probably that are watching this, are very sensitive to energy. We call them empaths. And I tell them to take a moment, because when they're living in this fear-based sympathetic overdrive and trying desperately to get back into parasympathetic balance, it really helps, in addition to all the wonderful things that everybody's mentioned, to just ask yourself two main questions. The first one is this fear, is this stress, is what I'm feeling, this anxiety, is it even mine? Because a lot of times, empaths especially are picking up on fear from the collective and from humanity, and it's not even your own. So taking the opportunity in this time to separate that out and get to know what's actually yours versus not is an incredible gift. And then when you are left with what those emotions are, and a lot of them have been sleeping giants, and because we don't have the distraction of 9 million soccer practices and racing around everywhere, they're coming up, and the typical inclination and response is to shove it back down. People are drinking more and just scroll on social media. And I'm telling the patients, don't do that. Honor it. If it's guilt, if it's grief, go journal, go outside, like address the emotion, sit with it for a minute, and then release it. And you're going to be so much better on the other side of this.
Wonderful. And Kathleen, I love that. Kathleen, having been through this and having, being on the front line, every day, is there anything that you'd like people to know?
Yeah, I think going along with that, just what I see in my coworkers, even anybody on the front lines, is a lot of people do struggle with like the mental health, and just we see a lot, and it's exhausting, stressful, emotional, and there's not always, it's something we've never been through before. So just which we are getting a ton of community support, but just lifting up each other and helping each other through this hard time, I think has been amazing. And if you know someone on the front lines, or really anybody, because anybody needs support right now, I think that's super important.
Well said. And I want to add my own 2 cents in here, as I often do. Here's the thing, guys. We are going to pick apart this episode in our life. We're going to pick it apart. And you've been a part of something really historical. So I want everyone to take this global pause, take this moment and really decide who you want to be on the other side of that. And we really have to encourage ourselves to be humanitarians now more than ever, because what people are experiencing may not be in your scope. You've got to really think about this globally and think about all of those houses, all of those rooms that we don't optically have the insight to see what people are really feeling and what people are really going through. I was going to the store the other day to get some materials, and I saw a mom with a tiny infant, and the little infant had a mask on, something I never thought I'd see. Little tiny, had a mask on, and the other child, her toddler, had a mask on, and they were running around like crazy, and the mother was freaked out, screaming, "Don't touch anything, don't touch anything." She looked exasperated, she looked tired, and I thought, gosh, we just really have to take this time and somehow feel gratitude and say, you know what? I am somehow going to serve. I don't care what it is. And you know what I did to serve? I said, don't worry, let me get the doors for you. What can I do to help? I said that to the mother. That was my way of serving in that moment. Try to find a way to serve in the moment, because when you serve and when you have gratitude, you shift out of the nonsense, and you shift out of feeling stuck, and you shift out of feeling anxious, and you shift out of feeling fear. So that's what I encourage you to do, along with everything else this amazing panel had to say. Dr. Pedre, would you like to close with anything?
I just thank you to everyone for just sharing honestly, Kathleen, for just being vulnerable and walking us through your path, and Dr. Gomes for also for being there on the front line. And I just want to say thank you to all the mothers out there. I have a soft spot for moms. I was a mama's boy, and we need more of that. We need more of the loving energy in the world. And I think maybe on the other side of this, perhaps we're going to look back and we're going to see this was the pivot point for humanity, through which we came out on the other side and we decided to live life from a place of heart and compassion for each other.
Yes.
Amen.
Well said. So I would like to invite everyone to see Doctor's Night Out tomorrow night, where we take our deep dive. And if you're feeling stuck, we have the expert that can unstuck you. Cynthia Pasquella Garcia will be with us, and her message is really piercing. And every day at noon, except for Sunday, we have our rapid fire. Please be sure to watch one of the experts that you see on the panel go through questions from moi, and we take you through even more information about topics you're interested in. I want to again personally invite this panel back again for part 2. As we can see by the time, it's already 8:21. Thank you, panel, for the extra time. We want to talk about what's on the other side of COVID. I'd like to ask this panel to come back, so tune in for that and much more at Doctor's Night Out, signing out with all the love and all the grace. Until next time, bye-bye. Good night.
Good night.
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 Night.